All right, and folks may have received a notification that this should be recording. I hope so, because it says it's recording on my end. So if you didn't, that might be a sad day, but we'll keep that going. Today, I do have the privilege to announce our facilitator, Dr. Ligaya, to introduce our facilitator, Dr. Ligaya Domingo. Ligaya is the Education and Racial Justice Director of SEIU Healthcare 1199 Northwest, and holds leadership roles at the local chapter and the national organization of the Asian Pacific American Labor Alliance, or APALA. Ligaya advocates for equitable outcomes in workforce development as a union trustee of SEIU Healthcare 1199 Northwest, a multi-employer training fund, and is a board member of the Workforce Development Council of Seattle, King County. Ligaya is a UW alum and continues to be very involved in the Harry Bridges Center. She's a member of the Bridges Center's visiting committee and received the inaugural Martin and Ann Juggum Scholarship in Labor Studies. This November, at the Bridges Center's 30th anniversary, Ligaya will be honored with the Robert Dugan Distinguished Supporter of Labor Studies Award and the inaugural Distinguished Labor Studies Alumni Award. So very excited to have Ligaya here today to help us guide through this conversation. And I want to turn it over to you, Ligaya, to add anything you would like and also to start our conversation.
Great. Thank you so much, Rachel. Happy to be here today. Hello, everybody. So we're going to be having, I think, a very exciting conversation. We've brought together folks who think about workforce from a lot of different perspectives. And I see a lot of folks on here today who are definitely thought partners of mine and others in thinking about workforce. And so just to start off with, we wanted to start with sort of a grounding connection on what is workforce and how do we think about it. And so, at a very basic level, workforce development is the societal strategy that's used to create initiatives that educate and train individuals to meet the needs of current and future business and industry needs in order to sustain a more competitive economic environment. The reality of how that has played out is that it has become very focused on what employers need and less so on what the actual workforce needs. And so today, we're going to be talking about different strategies that particularly folks connected to the labor movement have used to really create opportunities for workers to meet the needs of industry and employers, but to really center workers and to think about how to bring about more equity in the general system. So I'm going to start off. Rachel, could you please share the slide for me? So in addition to that, wanted to help people to think about the concept also of workforce equity. So when we think about workforce development, we want to kind of push the dial in terms of thinking about equity embedded in thinking about workforce development. And so we wanted to share this definition that comes from a study that the Workforce Development Council of Seattle King County did that was chaired by Marie Carose, who's on here today. So achieving workforce equity is a key component of building a thriving and inclusive economy that benefits all workers, residents, and communities. It will require coordination, collaboration, and integrated solutions across multiple systems. This calls for a systems thinking mindset and bold action. Business leaders and employers must adopt new mindsets and new practices that prioritize workforce equity and good jobs. Policymakers and philanthropic and community organizations must align their resources and efforts toward ensuring that working people can be uplifted rather than dislocated and insisting on high standards of job quality for all workers. So today, through our panel, I think you'll hear about strategies where we are working to really combine the efforts of community organizations, workers and partnering with employers to bring that about. In addition, I want to kind of bring about some thinking connected to how unions are also thinking about workforce development. And this is a set of worker-centered learning principles that I think, you know, even though this was written in 1990, in some ways is still kind of the cutting edge of thinking about how labor management partnerships could bring about something different in the workforce development ecosystem. So this really looks at education that is building on what workers already know, not assuming that people are sort of blank slates, but that we all bring skills and strategies from the time that we're children to them becoming in the workforce. And I think, you know, Washington State, certainly that is something that our governor has been really kind of thinking about and building on with the Career Connect Washington, and thinking about the whole person and what a person really needs in order to be successful in the workplace. So those are some of the things that I want to lift up in thinking about a more worker-centered worker development process. So with that, I'm going to introduce our first panelist, and we're going to start off with our panelists speaking a little bit about the work that their organizations do. And then we will go into some questions that we've prepared to discuss in front of you all. We haven't discussed them before this moment. So it'll be, I think, exciting to hear us sort of engaging in dialogue with each other. So to start off with, our first presenter is Karen Dove, who is the Executive Director at ANEW. Karen.
Thank you, everyone. Good afternoon. As introduced, I'm the Executive Director of ANEW. We are a 40-year-old nonprofit organization that has programming in 4 areas. We do construction pre-apprenticeship training, and we are moving on to add CDL training to our programming. So it's a pre-apprenticeship program, getting them ready to enter the workforce. We have the Apprentice Resource Center, which is support services and financial support for apprentices to help keep them in their apprenticeship, because we don't just want to get them in, we want to keep them in. We have our career exploration, which is exposing youth, in-school youth, to career pathways in the construction field as a first choice career. And the last program we have is the Rise Up program, Respect, Inclusion, Safety, and Equity in the Construction Trades. And it's a respectful workplace campaign designed to create a culture that's more inclusive to all people. So we provide those 4 areas of service, and really are training about 280 people a year. And in the Tri-County area, Pierce County, King County, and Snohomish County, as well as some other areas of the state.
Great, thank you, Karen. So our next presenter is Amelia Vassar, the Senior Director of Equity and Evaluation at the Imagine Institute.
All right. Hello, everybody. Nice to meet you all. I'm Amelia with the Imagine Institute. We are a professional development organization that works with childcare providers all over Washington State. And we operate under peer relationship-based professional using. They are uniquely qualified to deliver the professional development to their peers just based off of their experiences, their knowledge, cultural capacity, language capacity. They should be driving the work and doing the work. We were formed in 2016, but really what ended up happening was childcare providers organized in 2006, and they formed a union and negotiated their very first contract. 10 years later, they developed an organization to administer a lot of the benefits they received under their collective bargaining agreement. So some of our, like foundational programs that are funded by the collective bargaining agreement are our Imagine You program, which really is a way for interns or people who want to open their own licensed childcare provider or open their own family business, childcare business. They get paired with mentors who have successfully opened their own business, very established in the field. And the mentor guides them through education, through internships, and helps them complete all of the licensing requirements to open their own licensed childcare business. At the end, they're awarded $4,000 in seed money, and the mentor is also awarded $4,000 in seed money. So that seed money is really, really important. We offer all of our services, especially Imagine You, in at least English, Spanish, and Somali. Our training program is a way for childcare providers to become state-approved trainers themselves and to deliver the content to their peers. So childcare providers are receiving that education from people who do the same work as them in the languages that they speak. Through our training program, we were able to develop the very first anti-racist curriculum that was designed specifically for ECE providers in the country, and we have now started to deliver that curriculum nationally. And then our subpool is a mechanism that allows providers to access their paid leave benefits under their CBA. So they get about 5 days off a year, sometimes more, depending on funding. And so we have a training program for people who want to become a substitute. We provide free training, and then we can match you with providers who need a sub for the day or for the week or for a few hours. So it's the largest ECE subpool in the country. Last year, we provided close to 70,000 hours in subpool relief to providers. Some of the newer programs that are not funded by the CBA are shared services program, which is really just a community of care practice for providers to come together, talk about things that impact them directly, and get mentorship or guidance from people who do the work, and also kind of just reduce some of the feelings of isolation that they've identified that you experience as a person who works with children all day and you're not necessarily connected with other adults who do the same work as you. It was designed using liberatory design, and we have about 1,200 members enrolled right now in our shared services hub. Our newest program is technical assistance. So really, when it comes to utilizing some of the new funding grants that have developed as a result of COVID, they wanted to make sure that providers have the technical ability to navigate a lot of these really complicated application processes. So we work with childcare providers to deliver the technical assistance to their peers so that they can apply for these grants in the languages that they speak. Our TA speaks 7 languages so far. Often we can contract with additional TAs for increased language capacity. And through our TA program last year, we were able to help providers qualify for almost $300 million in additional funding. I'm just gonna tell you a little bit. I have a graphic that I wanted to show you, but don't worry about it. Gist of it was 2014, DCYF did this huge study to determine like what training looks like, who does the training and what languages that they speak. Big surprise, most of the trainers are white. About 90% of the trainers were white. They were not childcare providers, and over 90% of the trainings were done in English. They were not done when childcare providers were available. There was often a translation or interpretation, I'm sorry, but the classes were conducted primarily in English, sometimes with interpretation there, but that's how it was done. And so when we came into fruition, our goal was really to make sure that providers were delivering this TA to their professional development to their peers in the languages that most providers speak. We're always working to increase that language capacity. But right now we're at about a third, English, Spanish, and Somali at least. Last year, we increased our language capacity to include Arabic, and a really big need that we want to address is Oromo and Amharic, which is languages that a lot of our providers speak as well. Right now, some of the ways we try to do this is really making sure that we hire directly from the field. So a lot of our staff are former providers or current providers. They speak the languages our providers speak. It's a predominantly female workforce, predominantly BIPOC workforce. 62% of all of the revenue that we get goes directly back out to either providers or contractors that are childcare providers as well. So making sure that we are lean and we're tied operationally, and we can go ahead and put that money back out into the ECE field. Just to tell you a little bit about our growth, we started out with our CBA programs, our subpool, Imagine You, and training. We do some project-based work, sometimes with different unions like ESF, with the Machinist Union right now. We have some projects like Prepare for Care that we did with King County, electronic attendance that we did with the state, and then some of our newer programs that are not CBA funded. So the ability to go outside of what's bargained is a really strong potential. We've experienced just a rapid increase in funding. I think initially when we started, the idea was that, you know, this model is not going to work, that most of the time, you know, there is a really strong preference for education that is vetted through colleges, and the idea that childcare providers delivering education to their peers was not a model that was like deeply embraced. We've worked really, really hard for people to understand that that model is just as rigorous as an academic model, and to gain that credibility with the state. So we've got about a 14,000% increase in our staffing and a 900 increase in our budget since we've started. So that's kind of who we are and who we serve.
Thank you so much. That was really interesting to hear about. Our next presenter is Christina Rupp, Director of Post-Secondary Pathways, Palmer Scholars.
Thank you so much. It's a pleasure to be here with all of you today. I have the pleasure of working with Jonathan Jackson, our executive director, for the last 3 years. Palmer Scholars, it started as a grassroots organization in the Tacoma area in the 1930s, funding first generation community of color students who wanted to go to college. And those first 2 scholars graduated from the University of Washington in 1976 for a grand total of $225 per scholar for a 4-year education. So that was the very beginning of our organization. 2 young men from Lincoln High School, and since has grown to serve over 680 young adults who are first generation college bound. Jonathan had the vision to grow the program in a different way though, because as we all very much know, college isn't the only way to a high paying career. And we didn't want to be stuck in the rut of that message. So 3 years ago, Jonathan approached our local Workforce Development Council and received funding to start a career prep program, which we named Palmer Pathways. Through that first cohort, we were able to serve 11 young people, and have since moved on to have 3 cohorts and serve 38 additional young adults of color between the ages of 18 and 26 who are considered disconnected youth in the Pierce County region. Our program itself is 14 weeks in duration, and we do 345 hours of training, provide 10 certifications, have 14 direct entry articulation agreements, and 6 preferred entry. Direct entry means that you basically pass a drug test, fill out an application, and you are eligible for apprenticeship with that specific apprenticeship program. So it is a pleasure to be here with you today, and I look forward to the discussion.
Thank you, Christina. Our next panelist is Morgan Mentzer, co-founder and executive director of the Reckoning Trade Project.
Hi, thank you for having me. My name is Morgan Mentzer. I use she, her pronouns. I'm the executive director of Reckoning Trade Project. We do LGBTQ trade worker organizing with the intent of getting more LGBTQ folks in the trades and then shifting the trades. So once we're here, then there's some support and some retention that happens. We do that through employee trainings for employers, vocational schools, unions, and then we also do it through worker organizing. We have a monthly affinity group meeting for LGBTQ trade workers. We host events. And I myself am a part owner of a worker-owned automotive shop in Tacoma, Washington, and I'm really committed to the trades as a way for economic justice, as well as educational justice, a place for folks to really thrive and succeed that often may not fit in traditional areas of academia. Thanks for having me.
Great, thank you. Our next panelist is Amy Purcell, the Managing Director of the Training Partnership at SEIU 775 Benefits Group.
Hey everyone, good afternoon. It's nice to see so many familiar faces. I'm Amy Purcell. I'm the Managing Director for the Training Partnership, which is under the umbrella of the SEIU 775 Benefits Group. Our organization's mission is to improve the health, safety, and stability of the caregiving workforce through innovation and high quality benefits and programs. We partner with workers, employers, stakeholders, many like yourself, to collectively solve these workforce problems through innovation, creativity, and an evidence-based approach. We focus on delivering training, health, retirement, and job matching to the home caregiving workforce. So the workforce that we serve is the Medicaid universe. And so that is home caregivers, paid caregivers, who are serving persons that are eligible for home services under Medicaid funding, is the best way to think about it. And we provide the training for this unionized workforce. The benefits group has one of the it represents a very large union in the state. Our programs annually serve only over 50,000 home caregivers. And the training that we focus on is we want to focus on equipping these home caregivers to deliver high quality care and supports to older adults and persons with disabilities. And every caregiver that we serve is part of the SEIU 775 union. Home caregivers in Washington state have a set of basic and continuing education requirements based on their relationship to the person that they care for. So there's quite a few training programs that we offer. Annually, as I said, our programs serve over 50,000 home caregivers. We do our services in a range of modalities, in-person virtual like Zoom, or asynchronous, more traditional online courses as well. In addition, we deliver training in multiple languages. Home caregiving is an incredibly diverse workforce. And so we deliver training in English, Russian, Spanish, Korean, Vietnamese, simplified Chinese, Arabic, Amharic, Tagalog. I may have missed one. Our programs deliver orientation and safety, basic training, continuing education. We also have an advanced training program. And then we also run nurse delegation courses for caregivers for whom that's relevant. In addition, those caregivers that are qualify as what they call standard caregivers, which is just a distinction in the industry, also are going to need to take the high stakes exam administered by Department of Health. And we focus on preparing caregivers for that as well and offer supportive services. We have a very strong peer mentor program of fellow caregivers that provide support to those folks that are preparing to take the Department of Health exam, because we want them to do well. We want them to keep their job, but more importantly, we want to make sure that vulnerable Washingtonians don't go without care. So really lovely to be here today. Thanks.
Thanks, Amy. Our next panelist is Sukanya Pani, the Deputy Director of the SEIU Healthcare 1199 Northwest Multi-Employer Training Fund.
Thank you so much, Ligaya. Good afternoon. It's so nice to see everyone. My name is Sukanya Pani, pronounced she, her, and I am with the SEIU Healthcare 1199 Northwest Multi-Employer Training and Education Fund, and I'm going to refer to us as the training fund. I do recognize there are so many folks who are training funds, but I do want to acknowledge that's how I'm going to refer to us in the moment. So as the training fund, our primary focus has been serving our members across Washington state, and we focus on acute and ambulatory care, and our focus is serving members of the SEIU Healthcare 1199 Northwest, and it is a part of collective bargaining agreement wherein we are a Taft-Hartley trust fund, and it's a labor management partnership. In terms of the strategy that we work on, I'm not going to read all of it, but I want to highlight a few. As a training fund, at the very micro level, we are able to provide resources for our members, a benefit that allows access to members for education, which is extremely important in folks' career path. We are able to influence education systems. Often education systems may not be constructed for working adults. We are able to influence that system. And we are able to influence that system through public-private partnership resources. And we are able to influence that system with our 16,500 members that we serve. Another key piece that I always highlight is EDI is ingrained in our work, and what that means, I'm going to address it in the next slide. So at the training fund, we provide a lot of services. I'm not going to go through each one, but I want to highlight a few things. First being, we do provide tuition assistance resources to our members. This is a big one because we not only provide reimbursement, we actually have a voucher model, and 75% of our members utilize that. Because when you ask somebody, right, pay upfront, and then we will reimburse, those programs do not provide access. And so that's something that has been really important for us. We ensure that our members have navigation services. A lot of times, members may not realize their own potential, or they may be ambivalent, or even if they want to go back to school, they don't know where to start, right? And so we are able to provide them that supportive services, including tutoring on site and including other professional development resources. I do want to highlight one program, and it is an important one in that EDI context, which is our ACET program, which is Advanced Certification for Environmental Service Technician program. And the reason I want to highlight that program was when I think of career pathway and support, and from a DEI perspective, there are times career pathways are not created, they are not there. And sometimes it is because those paths may not be created with keeping workers in mind. So it is our members, our member leaders, along with management coming together to build a certification program for environmental service technicians. And what I want to highlight is when members complete that program, they get a $1 increase. So it's a tangible resource, tangible increase in that career path.
Thank you, Sukanya. And our last panelist is Evan Woods, the Executive Director of We Train Washington.
Awesome. Thank you, Ligaya. Thank you, Rachel. It's great to be here with everybody. So We Train Washington is a training and education nonprofit that's affiliated with UFCW 3000, 55,000 members, 35,000 grocery members, the state's largest local. We just launched in July 2021, so we're pretty new. Our mission is dedicated to improving job quality, economic security, workforce equity, and career pathways. Right now for grocery store workers, in the future for cannabis, healthcare, retail, and other workers represented by the local. I was going to start today talking a little bit about the industry, the workforce, the unique challenges of grocery, and our workforce strategy at a large level, and then a little bit about our program. So grocery is kind of overlooked, I think, as an industry. It's a $52 billion industry in the state. There's 1,500 stores that dot every single community. And I think during the pandemic, folks really understood the essential nature of the grocery worker, right? It was one of the few places you could go, the few places that we relied on to get food when everything else was shut down. And so I think it's a unique and important time to invest in grocery workers. There's 105,000 grocery workers in the state, 30,000 in King County alone. And our industry is really interesting because there's so many different professions. So if you think about a grocery store, right, there's checkers, courtesy clerks, deli clerks, seafood, produce, there's baristas, there's e-commerce personal shoppers, there's meat cutters. And so all these little occupations that used to be in different stores have been brought together into one place. And so there's a bunch of different trades under one roof. Demographically, female workers, workers of color, immigrants, refugees are overrepresented amongst our members, as well as low-wage workers. And gender segregation is a significant issue in our field. So if you think about meat cutters, seafood clerks, produce clerks tend to be male-dominated occupations. Baristas, bakers, checkers tend to be female-dominated, and that wouldn't be a big deal. But those jobs sometimes pay different amounts. The male-dominated occupations paid more than the female ones. This was addressed partially in the most recent contract, which is great. So the local negotiated so that those lower-paid occupations caught up to the higher-paid ones. So that was an excellent win. The other demographic thing I wanted to touch on is that sometimes English language learners, immigrant and refugee workers, are pushed into kind of back-of-the-house positions away from customer-facing positions that can have lower ceilings on their career paths. Grocery has been affected by a number of trends in the past 20 years. So think about the rise of Walmart to about a quarter of the grocery market. The top 4 companies are almost 50% of the market. So you have these huge national companies that you're bargaining with and trying to work with. And the non-union giants put a lot of downward pressure on standards and wages. Scheduling has gotten much more chaotic over the past 20 years. So it's all algorithmic scheduling. You oftentimes don't have the same schedule week to week. So it's hard to access workers and for workers themselves to budget and plan their lives. You have labor replacing technology like UScan. You have e-commerce growing and the growth of these gig economy companies like Instacart. So those are some of the kind of negative trends or challenges. On the positive side, Seattle is a wonderful place to be in the grocery industry, right? We have high incomes. People care about organic food. They care about high quality food. And so I think there's really this unique opportunity here. I think to deal with this or thinking about our industry, our workforce strategy, I would describe it as, I think a lot of traditional workforce has elevated folks, sometimes with an equity lens, from industries like ours into higher paying jobs or higher paying industries, a small percentage, maybe 5% or 10%. Our focus is really on bringing high quality programs and workforce into the place where women, workers of color, low-income workers, immigrants, refugees already exist. And so we're not trying to pull people out. We're trying to improve the jobs where they actually exist. And I think grocery is unique within retail trade because we have a 35% union density, which doesn't exist anywhere else. So we have a labor partner. On the specific strategy we're taking is trying to promote what we're calling a high road model, which is, experienced, well-paid workers, employers benefiting from higher sales and a better, more motivated workforce, customers benefiting from better service, more reliable service, and then unions benefiting from employees who are more engaged, members who are more engaged. And to do that, we're trying to build both employment pathways into the industry, programs for incumbent workers, and then high-skilled apprenticeships and pathways to management. So the programs that we specifically run, we have our 75-year-old meat cutter apprenticeship. It's the nation or the state's largest and oldest meat cutter apprenticeship program. We just designed the nation's first pre-apprenticeship program for meat cutting, bringing existing grocery workers and folks outside the industry into that meat cutter apprenticeship. We're designing the nation's first fishmonger registered apprenticeship program. So those are kind of at the higher skilled level of program design. And we had just launched a pilot for our frontline manager leadership development program for department managers, about 2,000 department managers in our industry. I think next year we're excited to work on a community pathways program that will welcome immigrant and refugee workers through a 40-hour boot camp into the industry where you have family health insurance that costs $90 a month. You could family 4, 5, 6, save incredible amounts of money, good middle-class jobs, pathways into meat cutting, into management and other programs, and then a new employee welcome program to reduce turnover and help people build careers in our industry. So those are some of the programs that we're thinking of working on. And I think I'll stop there and we can get to the questions.
Great. So as you can see, we've got a real diversity of industries represented here, and I'm excited for this conversation. So the first question that I'm going to pose, so I'm going to pose a series of questions, and a few folks are going to respond to each of the questions, just so that folks know what to expect. So the first question is, what are the benefits and challenges for unions and independent organizations of partnering with employers for workforce development? And I want to ask Evan if you could please first respond.
Sure. So I'll answer by way of example. So we are in the midst of our pilot for our Frontline Manager Leadership Development Program, which is a small program emphasizing leadership skills for supervisors who sit at this important point within a grocery store where they manage teams of 5 or 6. So they're really important to the rest of the members. Having a terrible manager sucks. Having a great manager makes your job wonderful. They're also part of the management team at the store level. So they're these critical pieces of the grocery store ecosystem. So we're partnering with Town and Country Markets, which is this North End, really high-end grocer. And partnering with them has been phenomenal. They gave people 2 full days off, paid. So they help with scheduling, they help with pay. They put input into the program design, which was great. They sent 2 members of their kind of training team to come help observe the program and also participate a little bit. They help with marketing, and there's just kind of this encouragement that I'm sure a lot of folks know about when say like in a healthcare setting or something. If your manager says, hey, this program's good, like you're in, you can do it, I encourage you to do it, is totally different than randomly reaching out to people without any sort of employer encouragement. So those are the benefits of working with employers. Did you ask about challenges as well, Ligaya? Okay, so the challenges that we've faced so far, and some folks may not face these challenges because you have a lot more of a reputation and more of a pedigree over time, but we've faced challenges around building trust and reputation. So we're a small organization, we're new. The employers have been doing this for decades, they really know their stuff. And so when you come in and say, hey, I'm going to train your workers, it takes a while to get over that credibility barrier. So that's one challenge. Another challenge is that as workforce organizations, particularly affiliated with a union and trying to be in this kind of joint labor management space, sometimes those issues between the union and the employer can bleed into your ability to work with the employer. So right now, I mean, we haven't established ourselves as much as an independent entity. So if UFCW 3000 is butting heads with a grocer, they may say, hey, we were going to work with you on that, but we're not interested at this moment. So that can be a challenge for working with employers. And then I think like the programs that I would love to do about the full development of the whole human being of the worker and these long-term timeframes and leadership development. And shoot, I'd love to do art. I'd love to do all kinds of interesting stuff, right? As long as it's within mission, right? Those may not fulfill the employer's needs on a short-term bottom line basis. They may be interested in other things that are not the full development of the worker as a human being. So that's also can be a challenge. So those are a few of the challenges and benefits that I see.
Great, thank you, Evan. And I want to ask Karen.
Thank you. I think there's a lot of benefits to working with the employers. You know, we're producing a product. And so when we work with the employers, we are crafting that product to meet their needs. And so making sure that we're adding value to their company is something that's really important. I think that we also that way get to keep the pulse on what's going on in the industries, and we're not just training people when there's no jobs. We're here to train people to enter family wage jobs, not just to train people to train. I think that also one of the challenges is that we have to break this myth that we are trying to get unqualified people into the industry. We're not trying to get unqualified people into the industry. We are trying to get some of the best qualified people who have gone through great training into the industry. And so kind of breaking that myth that these are, you know, people that check a box. Policy can be a double-edged sword. And so it's not just getting people in to check a box. It's not just getting them in to fulfill your requirements. It's getting them in and promoting them into leadership positions and and seeing that these are the best qualified people that is sometimes a little bit challenging.
Great. So the next question is, are workers being consulted or included in determining development priorities and needs? If so, how? And Morgan, if you could respond to that question.
Yeah, thank you. In the work we're seeing, where we get a lot of feedback from trade workers that we're connected with or work with, reports of how folks are being treated on the job site. And I would say, unfortunately, a lot of developmental priorities are not really honing in on what the needs are for a diverse workplace. We find that employees will go through exactly what reporting process is required for if they faced harassment, if they need accommodations. And those often fall on deaf ears. And if there is something that's done, there's not something systemically done. There's not something to address that, you know, this is a barrier that this person faced that other people are also going to face. So how are we going to shift our system to make it sure it's more inclusive for a whole group of people that are not our typical white, cis, male trade worker? And so I'm unfortunately not seeing the priorities shift as much as I think they should to increase diversity and really respond to workers' calls for what would support them in the workplace, what makes it a safer place. You know, I recently spoke with a woman who is an apprentice and she was breastfeeding, and trying to find a place to pump while she was working in the trades was seemingly impossible, something no one had ever considered or talked about before. And really, again, just fell on deaf ears. They kind of made a way for it to work for her, but not looking at, okay, so this is something, if we're going to have a workforce that needs to, that are breastfeeding, how do we create a safe space for them? How do we create, which will then create inroads of a more diverse workplace? So I would say, unfortunately, I'm not seeing it as much as I would like, where people report, this is how you can make this more inclusive for me and hence other people. But the systems aren't changing as quickly as they need to.
Thanks, Morgan. So our next question is, what are the issues, including barriers of entry, keeping workers from completing programs? What supports are being identified? And I want to ask Sukanya if you could first respond to this.
Yeah, thank you, Ligaya. That's an important question because and I'm going to answer at sort of two levels. One being for our members, what we often see is, so we have these benefits and resources available, but often when we talk to members on the ground, they talk about the fact that they are sometimes working two jobs, right? Or the job for two people, and they are caring for patients, right? So in healthcare, they're caring for the patients, and they carry this guilt where they're like, so, you know, they may say, yes, these are phenomenal resources, but in this moment of time, especially the pressure with the pandemic and the needs that is created, it does result in sometimes members not being able to complete a program or stop their program. We are able to provide navigation services, and from our perspective, that has been key to completion. So if you look at nursing prereq to completion data, and this data is from a few years back, we see in the college system, the completion rate to be at about 25%, but for our members, it is at 75%. So we talk about navigation and that support making a difference. Childcare, transportation, and other resources that are so critical in making that happen. I do want to acknowledge another key piece that we see and how our programming has sort of evolved even at the training fund, right? So at the training fund, earlier, we used to focus on incumbent healthcare workers. And then we started realizing that we also need to bring the community in. So we have a program called Introduction to Healthcare Apprenticeship Program as well as apprenticeship programs. And I will highlight a couple of things about these apprenticeship programs, which have been a change maker in terms of people completing. One, having a earn while you learn model, right? Earning from the very beginning is really important. There are, of course, the traditional college systems work for some who have to step away from earning, but that can be a challenge. So earn while you learn, that's been huge. Second, mentoring. It is extremely important to see someone who looks like you, is in a job like you, and is able to support you all the way through. That can be the difference maker in terms of being retained or not. And the third thing I want to talk about is competency-based learning and acknowledging credit for prior learning as well, right? So both of those. And the reason I highlight that is, I still remember it's been about 4 years back when we were starting the medical assistant apprenticeship. So I want to recognize one thing. In healthcare, we are the training agent for the Healthcare Apprenticeship Consortium, which is first in the country, multi-union, multi-employer training fund. And it has its own challenges when we were starting off. But the part which was so impressive was when we were developing the medical assistant apprenticeship program, there were medical assistants, frontline workers in the room, working hand in hand with employer to define what that competency is and what does it mean in their employer setting. That buy-in from the very beginning, them being mentored from the very beginning, has resulted in retention. So all that to say, there are various barriers of entry, but I do want to balance it out with the things that we are able to do to continue to support people to complete.
Thank you, Sukanya. Amy.
Hi, I figured I would be called on for this one. So there's a lot of different things we call our organization the benefits group that we do. One, I think, it's important to recognize that in home caregiving, unless there's someone to care for, there is no job. And due to the nature of caregiving, you can imagine, many of us have all been caregivers to someone young or old that we love in our life, that there are changes. There's changes in the client's health status, in the client's residential status. If the person they're caring for goes into a hospital, they lose their job. If the person they're caring for goes into a nursing home, they lose their job. If the person that they're caring for moves to Michigan to be with their daughter, they lose their job. And so there's a lot of pieces like that. And one of the things we've done to help alleviate it on our side is we have a benefit that allows caregivers to complete their training after they've lost their client. And so that becomes really powerful because it means that the process of getting your credential to stay employed as a home caregiver doesn't stop. So even though there's fluctuations, which is really common in this workforce and in the health of the person that they're caring for, we have pieces in place where they can continue and complete their training. And that becomes really important because there is a pay differential once they become a certified caregiver. So that's a big deal. And there's certainly a market for home caregivers. It's a huge need in Washington, a huge need, huge growth. And so there is a labor market out there. And so we didn't want their training to stop and the opportunity to stop if there's a change in the person that they care for. But there's some other things too. There's also passing certification. So as I mentioned in my introduction, there's a high stakes exam administered by Department of Health and their test vendor Prometric. We have a peer mentor program that supports that. But the other important thing that is a really good piece, because caregiving, while the union has made amazing strides in increasing the wages, it is often still a low wage workforce. And the certification, the cost of certification, which there's an application and then there's a test fee, that's a bargain benefit. And that's administered by our organization, by my organization. And that's huge. It's one less thing this group needs to do, the one less thing they need to worry about. We handle all the payment for them. There's no reimbursement. And that's also a really powerful thing, because even if they had to put out $150 for their certification and get reimbursed, that would have been a deal breaker and people would have left the field. So that's a big deal. The other amazing piece about home caregiving in Washington and the unionized programs is workers can complete the entire program in language. You know, one of the big barriers, to getting workers and keeping workers is language, right? I mean, if you are an immigrant or a refugee to this country and you don't have a grasp of English, there's a lot of occupations that are not open to you. This webinar would not be open to you if you didn't have a grasp of English. Caregiving is amazing, and caregivers can complete their entire program in language. So we make an investment in localization. And so that's translation with a culturally competent lens to make sure that caregivers have the information that they need, but also it's not just the curriculum, it's also making sure that we're doing outreach, our communication materials, our onboarding materials, our text messages. We've got to remind you to come to class. Those are in language too, everything. So it's really powerful. You can tell I'm passionate about it. It's an amazingly powerful occupation, because I don't know many other occupations in Washington where someone doesn't need to know English to earn a union wage job and union benefits and really have a career pathway. It's really powerful. So that's a big support that we do. The other thing, though, that I do need to call out is Department of Health. Department of Health has taken a commitment as well to localization, and the certification test is offered in language too. So another big piece in terms of those barriers. Language can be a barrier, and we've got supports in place to make that happen. Certainly, we deal with a lot of common barriers: childcare, transportation that Sukanya was mentioning, even just scheduling, getting yourself to class can be a big issue. We're looking at in next year releasing a new version of our curriculum that is half online, half in person, and the in-person component also includes a component on Zoom. So knowing that caregivers are place-bound, and even if you're not place-bound, even if you have a car, getting from place to place in Puget Sound or in our more rural communities can be really challenging. So having those online access points is really powerful. And the last piece is offering wage progression, that oftentimes a barrier to complete a program or staying in a program or staying in an industry is feeling like you hit the ceiling. So we partnered with the union and Department of Social and Health Services to create an advanced home care aid program. And that's a second 70 hours of training that caregivers can take. They need to pass it. They take our own assessments, but they do need to pass that. And then there's a pay differential at the end. So again, it's an additional support and really a recognition of their hard work, of their commitment to the field. And what it does ultimately is prepare them better to care for the most vulnerable among us. Thanks.
Thank you, Amy. Amelia.
Hi. I think, for providers, the barriers that really impact their ability really to open their own licensed childcare is, a lot of it is navigational access and digital access. Becoming an entrepreneur or a business owner with the state of Washington can be prohibitively difficult, especially if English is not your first language. And each year, the regulations that really dictate what childcare providers do and don't do and what they can and can't do increase. And so the expectations of compliance with WACs and stuff like that can be really, really challenging for providers. And it's not going to go backwards. We're never going to go back to where things are more simplified. It's going to become increasingly more digital as we go on. And so I think one of the things we really focus on when we are preparing people to open their own businesses is making sure that they have the digital capacity to continue into this field. So we start off with the assumption that everyone is kind of like at a very minimal level, depending on where you are digitally. We want to make sure that you understand how to navigate these systems, merit, WAC, all of that sort of stuff, because it's going to be a part of your life forever. And more than likely, it's going to be very challenging if you, for instance, a lot of our providers who come into Imagine You don't know how to like upload a document and put it in here. So we're starting off with like very, very limited computer skills, knowing that in the future, you're going to have to continuously upgrade those skills. So we start off with a lot of like just technological building so that as you are developing and Imagine You, you're completing more and more complex tasks. By the end of the program, you have developed your own policy that's compliant with the WAC, but we have to make sure that you have the ability to get your foot into the door with that support of your mentor and continue to update those skills, because those skills are going to be increasingly more important as Washington State makes child care providers as the field is becoming more professionalized, the expectations of you not only having a short certificate, but eventually an associate's and a bachelor's degree to maintain this your license. We understand that we would be doing a disservice if we didn't prepare providers for that reality. So a lot of it is preparing people for the reality of what's going to happen. Also, when it comes to opening your own business, if you don't know anyone who has done this before, it can be really, really challenging and discouraging. So making sure that you come into the business with a team of people that you know that you can call on when you have questions, that opened their license when you opened it, or your mentor, is really, really important, because it is a field where you are kind of like a business of one. Making sure that most people mention the language supports are there, not just with translation and interpretation, but like the supports are provided in the language that you speak, or if you want to open on your own business, you're matched with a mentor that speaks your language, that comes from your culture. And then I think the other barriers that we can really identify that we help people to overcome are just financial. So opening your own business is really great when you start off with some capital, right? But if you're starting off your own business with no capital, that can become really, really challenging. So if you're able to graduate from the program with a little bit of seed money, so that, until you get your first check from the department for, the children in your care, you've got some money to keep the lights on, to buy supplies, to, get food and stuff. That's really, really important. So with that program, we were able to wrap in a lot of supports. So far, we've been able to open 400 businesses in Washington State, but this year, we're slated to open 200 additional businesses and that just expands the amount of childcare that's available for Washingtonians. But it is definitely necessary to prepare people for the reality of more and more tech presence in their lives.
Great, thank you, Amelia. So we are gonna shift to a new question, which is, as workforce development opportunities expand in different industries due to increases in funding and workforce needs, how are you using these opportunities to achieve strategic goals? And Christina, if you could respond to that question.
Thank you very much. So for us, it's been an interesting journey through this expansion. Our program exists because of increased funding for construction trades employment. We benefit from funding that has been realized by our funders over the past 2 years. Our funders include the local Workforce Development Council, Workforce Central, Sound Transit, Career Connect Washington, and the Washington Women's Education Foundation. In Pierce County, as the silver tsunami hit our region and the pandemic took its toll on local funding and support structures, Tacoma lost its only local construction apprenticeship prep program, which was housed at Bates Technical College. It's called the Tool Center. And hundreds of people went through that program and benefited and were able to enter the trades because of the existence of that program. Due to financial collapse, not due to Bates's fault at all, just funding dried up and went away and was unavailable. It left a gaping hole in Pierce County. There was no program. There was no local program to serve our community. So that's how we utilize the opportunity, was to move from career prep into pre-apprenticeship. We already had the pre-apprenticeship structure, but it allowed us the funding to evolve that and grow it into a state recognized program that has 2 phases to it. It also allowed us to connect with individuals in our community through additional outreach funding that we wouldn't have had otherwise. And also staffing. It increased our staffing significantly. We went through from being the tiniest little engine that could, with 4 employees, to 13 in a matter of 6 months. So that's a huge shift and allowed us to provide more in-depth quality services than what we had previously been able to provide, and allowed us space to grow even more in our mentorship programs that we provide. And that is a huge component to both Karen and I's industries, that mentorship component, and making sure that there is access for a young person to learn and grow with someone that they can trust and feel safe around. So in our organization, we created the Palmer Connections platform, which is a mentorship platform, and allows for individuals in the construction trades and also individuals who are pairing with our legacy-based students who are going through 4-year college to have micro mentoring opportunities, whether it's an online question, whether it's a face-to-face, maybe 5 to 10 minute chat, or whether it's through a webinar structure or through self-guided e-learning. There's multiple opportunities for individuals to interact and learn about the craft they want to go into or the field of study they want to go into, and learn and grow from those experiences, and for our community to give back to young people and help them learn and grow into their fields of study or their career paths. And I really have evolved that into something that provides quite
Oh, Christina, I think you muted yourself early. No, okay, great. Okay.
I actually didn't, so, but that's okay. I can just leave it where it was.
Oh, did you have more to say?
I did, but it's okay. I can.
No, keep going, keep going.
Okay. So, so besides the Palmer Connections platform and the opportunities provided youth in our area to connect with individuals that may not be able to communicate during regular work hours, which is a lot of the individuals in the construction trade, that allows for evening and weekend opportunities that are micro events less than 5 minutes. So it still allows someone to have an impact and feel like they're giving back to young individuals in our community, but also allows those young people to grow. So other things it's allowed us to do and was other strategic realizations. It also allowed a bunch of partners to come together in Pierce County, including Karen's program, New. And amongst a bunch of us, created the Pierce County Construction Consortium, which is a way for individuals who are employers, union apprenticeships, non-union apprenticeships, unions, and everyone else from CTE programs to higher education, whoever the individual may be, nonprofit organizations, or even individuals from our community can come on and share information about trades, employment, and trends. And that had gone away. It had been defunct for 8 years in our region. And so there was no exchange of information between organizations, between providers of services, and everything became very siloed. So the blessing of what's happened with workforce needs and funding is that it's allowed that to come back into existence, for these collaborations to rebuild themselves, and for more individuals to be able to have access to the trades ever before in Pierce County.
Great, thank you, Christina. So we are now going to pivot into really thinking critically about questions connected to increasing diversity and promoting equity, inclusion, and diversification, and addressing income inequality. So we have sort of 3 questions. I'm going to put them all in the chat and read them out. And then I'm going to call on all the panelists to sort of address how you want to talk about these issues. So what are some of the key questions and considerations you have addressing the need to increase diversity in the workforce you're supporting? How are your programs promoting equity, inclusion, and diversifying workplaces? How is success being measured? And how are the programs addressing income inequality? So I want to start off with calling on Amy.
Hi, these are such important questions. When I think about some of the work that we've done in terms of increasing diversity in the workforce that we're supporting, it has to be noted that, our workforce that we serve is diverse in certain ways and not diverse in other ways, like a lot of workforces. So unlike other, more what I think of as traditional trades, the workforce that we serve is predominantly female, it's predominantly people of color. And that demographic and that profile really comes out of the paid caregiver movement. That movement was started with women and women of color predominantly. So we see a hugely diverse workforce already. But as well, the workers that we serve oftentimes become a worker, become a home caregiver because of the health of someone that they love and care for. And so it could be any of you. Any of you could have a loved one day, and who has a healthcare decline and needs a home caregiver, and it could be you. So it really is. While we do serve more women of color, a pretty high group of caregivers who would classify themselves as speaking a language other than English. It's constantly changing. It's definitely a piece. And so that's a big piece of it. The key questions and considerations is constantly examining our data. Who are we serving? Who are we not serving? Who are we not serving well? And continuing to pivot. So for example, one of the things we take a look at in a big way are, we call them emerging languages. So what are languages for which there's a smaller presence in the home caregiving workforce, but maybe poised to grow because of immigration, because of refugee policies, because of whatever is happening in our communities. So that's a big piece, is keeping track of that. As I mentioned, the language access is huge. Localization is big. So localizing with a culturally competent lens. So making sure that the curriculum that we author doesn't use idioms and things like that really are challenging to localize. So making sure that we really set up our curriculum for success. The other piece though, and I think someone else had mentioned it, is peer mentoring programs are so important. And our peer mentor group is an amazingly diverse group. It comes from caregivers. These were full-time caregivers who we've hired. They're working part-time or full-time for us, oftentimes continuing to be a caregiver themselves. So I do think it is really important, in terms of increasing diversity. Workers don't want to stay in a field if there's not someone that looks like them. So that's a big piece of what we do. The other piece is listening to the caregiver voice, the home caregiver voice, particularly when it comes to continuing education topics. For the basic training topics, we are governed, and all community providers in the state who do home care training are governed by Washington Administrative Code. There's not a ton of flexibility there, but in continuing education, there is. So definitely listening to the workforce is huge, because if the workforce feels like, you know, I'm really struggling with XYZ, and we then take that input and create a course that supports them on the job, they feel like they've been heard. And of course, folks that are more qualified are more confident in their work and more likely to stay. So that's definitely a big piece. Some of the topics we've chosen in the past are hoarding is one. We've done a course on scabies, bed bugs, lice, and fleas. These are topics that, you know, caregivers are saying, we're seeing this, we're feeling this. This is an issue. So meeting their needs, listening to their voice. The last piece in terms of increasing diversity, and I think as well, kind of the next question on kind of promoting diversity, equity, and inclusion is some of the work that has been led by 775 that we've really worked to support on. They have a campaign called Had It, and it's about reducing harassment, abuse, and discrimination among the home caregiving workforce. Home caregivers are, you know, they are providing care oftentimes in someone's home, oftentimes with just themselves and the person that they're caring for. Sometimes there's other family members. It can be very isolating. You can imagine it is, it's a workplace that is perhaps, I would say, ripe for discrimination, for abuse, and it happens. You can look back at some of the work that you know, the caregiver members have done in testifying to our legislative bodies here in Washington State about some of the horrors that they've experienced. So one of the things we've done to follow along that work is make sure, as a learning organization, we offer supports. So, for example, courses on dealing with challenging behaviors is an example of one such course. How to handle these kind of situations. You know, it's not going to provide all the supports, but it is one piece of the puzzle in terms of the promotion of a more equitable workplace. Thanks.
Thanks, Amy. Sukanya.
Amy, a lot of what you said actually resonated. So I did want to highlight a few things, which is really important. I can be very verbose, so I'm trying to sort of capture succinctly. And the three sort of words that come for me where we focus on diversity is access, agency, opportunity. And the reason those three sort of words come for me is when I think of access, for example, right? I think of, for example, I was talking about our ACET curriculum, right? It's a certification program for environmental service technicians. And so our union had made this, had bargained a $1 increase if somebody completed a certification program. We went and worked with another organization that was doing that program. The biggest sort of element where we started recognizing that it was not all aligning, couple of things. First, when we think about the curriculum, there were a lot of jargon words, right? And there were multiple choice questions. So it's not that our members didn't know how to do the work. They've been doing this work for years. But it was those questions that used to trip people up, right? So we wanted to make sure we develop a program that's really looking at skills and being able to develop around that. The second thing, which was also important, and which is something we are keeping at front and center, is who is considered, and this is a big one, who is considered a subject matter expert? And oftentimes when we go and talk with employers, they see that term almost equivalent to a supervisor or manager, right? So subject matter expert, supervisor manager. And so what we have been trying to do and create the space where members are recognized, as well as not just they are provided that opportunity in the moment to develop something, but they are supported all throughout, right? For us, that's a really big piece. That support is a key piece in that diversity element. There is another element I want to address is, as we have been doing more and more programs in the community, be it with English language learners who come into the healthcare workforce, or be it immigrants and refugees coming into the workforce. One of the key elements is not just bringing them in or into positions, but is ensuring that they can thrive, right? They can bring their full self. And a key piece with that is, I feel, extremely important in the programming that we do is a couple of things. One, if I think of our members and the diversity of our members, who do they know about these programs for and want to do the programs? It is often their co-workers, word of mouth. That's the most powerful thing. So we've been looking at continuing to sort of tap that, while also ensuring that when we are talking about workforce development, training, we are not just talking about bringing people in, but we are talking about retention. And the reason I highlight that is, so at the Training Fund, we are extremely excited. We are doing behavioral health apprenticeship, right? So really exciting. And with that, there are employers and some smaller employers that do not even have a plan around diversity, equity, and inclusion, right? I'm not talking about tokenism. I'm talking about a plan, right? They don't have a plan. And as a part of the work that we do with employers, with members, with labor, is ensuring that as we do these programs, there is a DEI plan in place. There's a sustainability plan in place, so that these programs just don't come and go, right? They're not blips in a workforce development or career path. So I think those are the key elements that I really wanted to highlight. And last but not the least, I think the one other key piece which I have felt is really important is members with lived experience. How do we lift that up? Without, I know there are lots of professions which have fought for professionalism, right? And being recognized, but recognizing that uplifting caregivers and knowing that in the healthcare caregiving, it's not just the registered nurse, it's not just the respiratory tech, it's the EVS caregiver, food service representative, just the whole spectrum. They all play a key role in health caregiving, is where diversity, actually the rubber starts hitting the road, right? When you start recognizing that. So I wanted to highlight those pieces and how our programs are connecting with that, because we can develop a career pathway, but that career pathway has to be centered around the community that we serve. And that's been our focus as we do all different programs and initiatives.
Thanks, Sukanya. Morgan.
Thank you. I would second what everybody has already said. I think that we all are really on the same page with a lot of this. And what we're really seeing is, in terms of increasing diversity in the workforce, again, it's the systemic change. It's that there's going to be folks that are representational of diversity, who are hearing complaints, who are talking about it, taking it seriously. I think that the information is getting to managers, foremen, business owners, administration in vocational schools, but complaints are being taken seriously. And so we're not seeing that systemic change. And we really see that the representation of diversity is so critical. Also, community support, where people have a place to go and talk about, this is what's happening to me, coming up with ideas for how to navigate it if your complaints are falling on deaf ears. And really, how can community organizations come together to say, we know this is happening, this is a problem. I think that really the community organization support, accountability coming from the community, accountability demands coming from the community has a big impact when folks are seeing that there's not actual substantive change in ideas around diversity and how to create inclusion. So I think it really is takes community support, it takes representation in leadership is so important, and a real willingness to recognize that these discussions about worker shortages, I mean, workers are here, and so how do we create the safe space to diversify the workforce, and then see that diversity as a value, see different ways that people think through problems, different experiences they bring, challenging what we understand to be the status quo is actually a way to build a more sustainable workforce. That if you have people that are coming in and saying, well, this is how I've managed to survive as a trans person without recognition, legal recognition, here's ways to create a safer space. It's not maybe legally required, but it is something that's best practices. So I think really thinking about how we can, diversity strengthens us, builds, if we're working for the most marginalized folks, we're building a safer community for everybody, community accountability, organizations working together, demanding accountability from employers, vocational institutes. And then that just system-based change where people take complaints, concerns seriously. They have someone they feel safe reporting it to, and just holding those values as critical to the organization or institution.
Amelia.
Well, when it comes to the, childcare provider workforce, it is already incredibly diverse. And that's kind of the problem, is because the people that typically do the work, which are Black and brown women for the most part, are intentionally excluded from, compensation policies that, as domestic workers that typically benefit other workers. And so it's a blessing, and also because of who's doing it, it results in the fact that the work is not valued or seen as something that needs to be compensated adequately. When it comes to how we can advocate for increased wages, I think one of the things that's really important for our organization is to really push back with the state and other, funders, is to say childcare providers are more than capable of providing the professional development. They have the skills, they have the ability to do, they know what they need, and they know what they need to know. They're completely able to do the work and to drive policy, if only you would listen. And so really encouraging more liberatory design methodology, which now the state is now adopting. So the state is including providers as thought partners in developing new programs, which is really, really exciting to see. But in a way, the people who do the work has been one of the reasons why it's so underpaid. And that's been just a very intentional thing. We do our best as an organization to contract almost everything that we do. So we do the administrative functions, and we talk to the money people, all of that sort of stuff. But when it comes to who's actually delivering the work, those are the providers themselves that are actually doing the work that needs to be done. And we're making sure that when we contract with providers, we're paying them a reasonable wage for their expertise. So, those are some of the things that we really work to implement as far as just addressing income inequality. Some of the stuff, it's partnering with the union, with the Child Care Workers Union, and we try to be very careful. So with us, we focus mostly on the professional development piece. And when we hear things, we're talking to 9 to 5 to say, this is what's going on, this is what's affecting childcare providers, and ensuring that, the union is aware of issues or things that are percolating among the provider field.
Great, thank you. Christina.
I don't have anything to add that's already been said.
Okay, Karen.
Yeah, thank you. I agree. There's been a lot of great information that's been talked about. I would say something Morgan said, you know, diversity increases a lot of things at work. The generation of ideas, there's a lot of benefits having a diverse workforce, but the one we don't talk about enough is the fact that it increases your revenue, because that's at the end of the day what businesses want to hear. So we need to make sure that we're keeping that conversation in there too. We created Rise Up, Respect, Inclusion, Safety, and Equity in the construction trade specifically for this reason. Our whole mission was to get more women into construction. And we're actually very lucky here in the Pacific Northwest because we're one of the highest percentages of women on the tools in the country. Boston and Seattle are the top two places. However, after a couple of years of doing this, it's like we're getting people in, but the frustrations that they're experiencing when they get on the job site, it's like, what are we doing? We're setting them up to fail because we're saying, yeah, this is a great career, but you're going to go in and be treated like shit. You just have to kind of suck it up in order to get that paycheck. And so at some point, we decided to take on this culture issue as part of the retention issue. And part of that is providing training and technical assistance for these companies that's culturally relevant. In the construction industry, you can't just take a pocket class out of an office setting and put it in the construction industry. That's not culturally relevant to them. So we created Rise Up specifically for the construction industry by tradespeople so that it resonated based on their values of safety and productivity. We don't talk about social justice values. We talk about safety and productivity and how this relates to them, because a contractor wants to know how to keep their job site safe and how to make more money. So making sure that we're providing that kind of training and technical assistance is important. I think that it's not enough to get people of color, women into the construction trades. We have to make sure they get into leadership positions. We will not change the culture. At the end of the day, we're not going to change the culture if we don't change the face of construction. And changing that face means we need women and people of color into leadership positions. So we can't just get them in. We have to figure out how to challenge employers, how to challenge unions to ensure that women and people of color are getting leadership positions. And then, in the construction industry, we need to get rid of good faith effort as an excuse as to why people aren't actually doing the work that's required by policy. So Morgan talked about systemic issues, right? So then we put policies in effect that help to try to break these systems, and yet we still have excuses. We can just say, well, good faith effort, I tried. So even though we're trying to change the system, there's still little ways that they're trying to get around it. So we have to hold people accountable, which was one of your questions. We have to measure it. We have to hold people accountable. We have to publicize what contractors are doing good work and what ones are not meeting their requirements. That's really critical. One thing that we've seen with our Rise Up program is the number of complaints have tripled in some cases on job sites that have received this training. And you might say, well, that's not good. It's actually very good. We've had 2 noose incidents here in Seattle in the past 3 months. I don't believe that we're just getting more noose incidents. I believe that people are starting to speak out about the noose incidents. And this is because people are getting this information, people are advocating, people are becoming allies, and people are speaking out. And so we have to keep that message. I'm done with people saying just, get thick skin. We have to be pushing back in order to change this culture. So that's kind of what we're trying to do. Thank you.
Thank you, Karen. And Evan.
Hey, I'll be very brief because I want to leave time for questions. So to echo things that folks have said. I think the union is central. The fact that the union is a partner in this, having a union contract and having people move up based on seniority is critical. And developing that space to bargain over things like this and provide benefits. I think what's interesting is, hearing about the work that Amelia is leading with childcare providers, already a very diverse field, and empowering childcare providers to determine their own priorities. The work that Sakanya is leading with the EVS certification and the MA apprenticeship, what Amy's doing with long-term care workers. That to me highlights like workforce development investment in industries that are already diverse, where women, workers of color, immigrant refugees already work, is so critical. It's important. It's very important to diversify software developers and the very highest end occupations. That's important work too. But this is critical to be able to invest public dollars in industries that are already diverse. We've had great success with intentional recruitment. We have an engagement director when able to have very representative groups. Our meat cutter pre-apprenticeship, a third of the meat cutters coming out of that were women who were placed, which is fantastic. The industry average is 11%. So I think that intentional recruitment, keeping a very high standards of making sure everyone's coming in to those programs is important. And to the last question about income inequality, I think it gets down to investing in these service industries and the industries that are lower paid, because look, going from $30,000 to $55,000 is a huge increase. It's a massive increase for folks. We had one participant, single mother, Ariana, who graduated from our meat cutter pre-apprenticeship. She got a $25,000 boost. That's reducing income inequality, and that's promoting equity. So I think the union and focusing workforce dollars on industries that are already diverse, that are maybe more low wage, mid wage, is a critical way to address this.
Great. Well, we've heard a lot of really interesting things. I'm excited to get into the Q&A. But I'm going to offer a few sort of insights before we get to that. So I think, we heard from folks across various different sectors of the innovative work that is happening to really change the workforce and to really meet the employer needs. And I really want to just appreciate the honesty that people just brought forward in the discussion around diversity and equity. I feel like I've never been in a place where people were that honest about what the challenges are. In a lot of spaces, we hear a lot from employers about wanting to diversify as if it's like some easy thing to do. And part of what you all lifted up is the reality of how difficult that actually is if we want to do it right. If we want to actually retain these folks and move them into leadership roles, it needs a different level of support. And folks talked about some of the innovative things that we have been able to do to bring those levels of support, but those are relatively new things. And it has to be much more robust to transform the workforce system. And this issue that folks are raising around really listening to frontline workers seems really critical in terms of this piece. If employers are not willing to hear the challenges that folks are facing and not willing to even put their own dollars in to help support, there's no there. And so, part of, I think, one of the challenges of the workforce system is that WIOA is very limited in terms of what it can fund. And the reality is that we have to use braided strategies. And grant funding is time limited. And so there, I think, are real questions about what are the long-term strategies for ensuring the investment of the workforce of the future. And so I think that that's, sort of the critical next question for all of us to engage in, because most of what folks are doing is because of grant funding. And, some of these situations, employers have put in the money to invest, and that's really critical. But on a lot of these things like apprenticeship, it's reliance on state funding. And so is that always going to be there? I don't know. you know, and is the federal funding going to be there? I don't know. Is it ever going to change? Because we really need WIOA to change. And so those, I think, are some of the big questions for the future for us to engage in. But I want to open it up for, you know, audience response and any other questions that folks want to raise up. And I think if you can put it in the chat, and Rachel, if you could call on folks, that would be great.
We'll do so. Thank you.
Oh, okay, you guys, don't be quiet. Glenn, I know you have something to say.
Yeah, I got a question.
Please jump in, Glenn. Go ahead.
No, just what Ligaya was saying. I've been at this work 35 years, and this is an incredibly impressive group of organizations and leaders. And thank you for organizing us, Rachel. One of the things you just said, Ligaya, it's almost like there's one more paragraph to finish what you were saying, which is if all the organizations and unions that were in this room today, including their training funds, got together and had a more comprehensive strategy in the state, much more could be accomplished. First of all, sharing with many broader groups of policymakers and others, the making visible to them what is the invisible benefits of so many of these programs is just one. There's an educational element, but there's a political aspect to this, and advocacy could be so much stronger if there were more forums like this that could lead to somewhat of a joint program of advocacy. And there's other examples of this around the country, but this is incredibly impressive. If someone were to ever do the research and calculate the quality and impact of all the different programs that everybody in this meeting is engaged with, including others that aren't represented here, there's many union-based programs that are not here today. It would be incredibly significant and really inform those larger strategies. But yeah, the solution to many of these problems is maybe having a union and having a training fund. Maybe that would be a good goal for every industry. So it's not a question. It's the question is, could we, Rachel, continue this dialogue in a way that could potentially lead to something along those lines, some kind of collective strategy or compendium of all the different programs and the impacts that they're having on these core issues of job quality and equity and so on, and kind of calling for some specific linkages. Because we know where the subsidies go. They don't go to immigrant and refugee workers, people of color. They don't go to low-wage service workers.
Yeah. I love that you brought that up, Glenn, and I'm also not surprised and want to thank Glenn for some of his connecting with me before this happened as well, to be a partner in thinking about this event. So that would be the goal of this, is to think about ongoing conversation and what makes sense coming up next. So every panelist that was invited here today, and a couple of folks who were unfortunately ill and were not able to make it at the last minute, do a really amazing work in their communities, and having the experts come and talk about the work that they're doing. And also, just like Ligaya mentioned, be able to name, like, these are some of the real issues that are coming up, I think is invaluable. But I also want them to let me know what was needed as well, because I'm interested in learning more and seeing what I can do to support, but would love to talk with every panelist about like what would be a good next step, as well as Ligaya and others who participated in the thinking about this. But I'm open to whatever we decide, leading with the folks that are supporting workers in this work. Thank you, Glenn. I think I may have seen a question come in. Maybe I just was hoping, because we'll have to call on folks. Oh, Marie has her hand up. Marie, please jump in.
All right, it's muted. So thank you, Marie Crossid, Workforce Development Council. I just want to thank you for this conversation and recognize that, yes, Ligaya, you're right. WIOA is not going to get us out of this. We're not going to get any equity with WIOA, but also recognizing WIOA resources are minimal compared to all of the other program dollars being thrown out. And again, I would say programs are not going to get us out of these structural issues. So while they may be good and help a number of people, if we don't address some of the systemic and structural issues in our industries, childcare workers, I'm sorry, that needs to be an employer responsibility. They can't get workers. The cost of living in King County, Seattle, what it costs to just live, be self-sufficient, not to thrive alone, isn't covered by a childcare worker's salary. So how do we start pushing for some real systems change so that our workers who are doing the critical work? I think the pandemic should have highlighted the need for these underpaid workers who are doing the critical work, and how do we value them as a society, but look at different ways that our benefits live. How does the state look at policies about reimbursement rates for, behavioral health care workers? I had a conversation with some of the communities of color, behavioral health care clinics, and they're saying, first of all, we know that we need culturally based behavioral health care curricula and training. And they're really interested, but the reimbursement rates won't pay, just don't pay enough. So I think we got to really look at the way we value or don't value workers and really think about doing that collectively, and also quit thinking about, well, programs are really great. It's not just programs alone. Karen is in the construction field. That was rooted in, 40 years of struggle trying to open up the trades. And sometimes we're talking about the same issues now that we talked about 40 years ago. So really, I would just think it really needs to be partnership with communities, especially communities that are like the lowest paid and undervalued, and folks of color, and how do we actually rise some of those and look at changing the model a bit. I just appreciate this conversation.
Thank you very much, Marie. Is there other things that folks are thinking about? You can just go ahead and jump in as well to the conversation and make yourself heard. Too much excitement, too near 5 o'clock p.m. Go ahead.
Rachel, one of the things I wanted to mention is, and someone mentioned it earlier, is credit for prior learning. So credit for prior learning in this state is when there's an industry recognized credential, then there can be basically credit given at a fairly low cost. And one of the things I think from my standpoint is, running our training fund, it's really hard to coordinate with 34 community and technical colleges. So I think that there could be some movement on, could there be some statewide policies, or I don't know if we want to call it agreements, reciprocal agreements, something around credit for prior learning. If it is an industry recognized credential, why does the program have to go out and negotiate with all the schools? Like, is there some sense there? So I would just leave that with the group to think about.
Yeah, bravo. Sorry.
Thanks for adding that in. Seeing some thumbs up, and Glenn said bravo, so there's definitely some agreement. Emmanuel, I believe I see a hand up, and if I'm not seeing that, please jump in.
Yes, you are. Can you hear me okay? Well, hi everyone, my name is Emmanuel Flores. I'm with the Washington State Labor Council. I'm one of the workforce development directors. My pronouns are he, him. And, I wanted to, I have a question and a comment. I'm going to start with my comment. Some of the things that, not some of the things, but a lot of what was presented here today, and I want to say thank you to the presenters and the panelists for the discussion and just kind of all the thought that comes out of, that goes into discussions like this, as well as the thought that is agitated into people that are here listening to all this. And it's a good agitation, right? It gets the brain going, like, what are the things that we could do? And what I was hearing from Marie was just, there's all these different ways that we can approach these situations. And we have come from, we have made advancements, but there's always room where we can better our best. You're right. Practice, practice, practice doesn't make perfection. That's a facade. The reality is practice, practice, practice. We keep trying to do better because we're trying not to get to that next level. And so my question is in kind of things of that next level, kind of curious on if the programs connect, or is there a way in which programs connect with youth that are transitioning, or is there a way that they have seen youth, high-risk youth, that for whatever reason find a path into a GED program? Is there an experience where those students transitioning to the workforce or young adults are finding a pathway to a preferred entry program or these apprenticeships or these training programs? Because it sometimes, as I'm understanding that reported by OSPI, that it's almost with the GED, it could potentially be like, I think they said like $40,000, $50,000 difference in just a couple years time. And just didn't know if there's a way to maybe, as we talked about workers struggling and stuff, if there's any ways to alleviate, shorten that time, or make that transition smoother for the individual. And again, all these, thank you to everybody. I mean, all these programs are really great. I am a product of a registered apprenticeship program and have found my path on education, among other things. But I will stop there with my question. Thank you.
I'm wondering if anybody would like to jump in and address what Emmanuel said, or just add to that. Thank you for naming that, Emmanuel.
So Emmanuel, just to paraphrase your question, you're asking if someone who's with or without a GED or high school diploma will experience a large discrepancy in pay when entering the trades, correct? Depending what kind of apprenticeship it is and that nature.
Yes, partially. Upon exiting the high school diploma path, and finding a different path, because they're all different modes. I did better in registered apprenticeship than I did in high school. But in exiting that, there seems to be either the 10-year float or just a gap that happens. And I've often wondered, I would imagine there has to have been, like, this is, there's, as thought has come across, but are there successes that shrink that timeline and connect people that much sooner? Or, are you all already engaging into things, and if so, how?
Yeah, and so I can talk because we only serve individuals between 18 and 26 years of age, and many have been disconnected from the system. In fact, in Pierce County alone, we have over 15,200 individuals between the ages of 18 and 24 who are fully disconnected from employment and any kind of training system. So, and many of those without completing a GED or high school diploma. So from our perspective, I can just talk about two scholars who recently graduated, one who has a GED and one who does not. They both entered the same trade and were accepted the same trade and have the same baseline pay and will have the same increases in pay. So they're both starting at $29.52 an hour, regardless of the degree. So that was something that we were very careful about and intentional about when we selected our partners. And I know Karen's the same way with the new, is that you have to have an intentionality of understanding the wage scales and progression and who those jobs are open to, because we can't create another barrier by saying, because you haven't pursued a 5-course GED, you're not going to be able to get a high paying job. And that's something that we're very passionate about at Palmer Scholars. Thank you.
Yeah, and I'll just piggyback on that. There are trades that require a GED, right? So when they go through our program, we assist the students with getting that during their 12 weeks of programming. So that is part of our program. By the time they graduate, they need to have a driver's license, they need to have a GED or high school diploma equivalency, they need to be able to pass a drug test. So that's part of our programming, is to help them get those things. And we're, Tina Orwell also got some funding to run summer programs for youth ages 16 to 24 that she's calling Running Start for the Trades, specifically for this, to try to connect the youth that are disconnected into trades pathways. And so there is some work going on in this industry. Youth Build, they specifically serve this people, you know, Palmer Pathways, they serve these individuals. So there's programs that are definitely focused. We have some programming that are focused on foster and homeless youth and justice involved youth. So I think there is a lot of work being done, but we're not measuring the culmination of all that work to show the impact collectively.
And Emmanuel, I think Karen brought up a really great point there. There is a bigger barrier that we're not talking about, and Karen hit it right on the head in what she was saying, is that sometimes it's not even the piece of paper and the degree. It's getting that driver's license, getting a vehicle that's safe to drive, and getting the registration for it so you're actually eligible to even apply for the apprenticeship program. Those are enormous barriers, especially now that they've eliminated driver's ed programs from high schools. And a lot of the individuals that we are working with are aged out of foster care and haven't even had access to a car, nor even ridden in many cars, and have taken public transportation most of their lives. I mean, these are enormous hurdles. And I would say those hurdles sometimes are the end all be all of someone getting that higher paying job.
I want to thank Christina and also Karen and Emmanuel, of course, for the question on that. That was really, I know, Dan, I always love to feature you, but also we're running a little low on time. So I think that question that you have, I'm making a note of it. And I think that is something that we can think about for a further discussion in the future as well, because I think that's the kind of question that we might spend another half an hour. And I know my facilitator needs to go. So we're going to, I'm going to wrap this up for now, but I also want to just take a moment and say thank you again to every single panelist who took time out of their day to join today and share their expertise, and to Ligaya Domingo as our facilitator for thinking about how to pull this together. It can be a little difficult with last minute switching and just things that happen in life, right? So I want to thank everybody for taking their time and all of you for joining as well. These are really fun opportunities for myself. I'm newer to my role to connect with folks who do the work that I'm interested in doing and just learn more and think about how to further collaborations. So is there anything that any panelist or Ligaya would like to add to close us out?
Well, I just want to appreciate the work that you did, Rachel, and pulling this together was really excellent, and look forward to continuing this conversation elsewhere. Thanks, everyone.
Yes, thank you all. Thank you all, and we hope to see you soon.